Welcome to the Tech Egg. Don't get scrambled. Enjoy the video.
You start by confirming the clinician's order and verifying the indication. This protects the patient and you. Once done, clearly explain what will happen and obtain the patient's consent so they know expectations. Make sure to gather comfort and monitoring items and have a trained colleague available. That reduces risk. I'm not giving technical removal steps here. Rather, I'm guiding you to a safe, supervised approach so removal, when done, occurs under proper clinical direction. Next, perform a thorough assessment. Review allergies, current medications, and recent urine output so you understand risks. Once that's complete, evaluate for pain, fever, erythema, leakage, or bladder distension, signs that may require clinician reassessment before any removal. Position the patient for dignity and comfort, and ensure assistance is ready for transfers. This minimizes falls and strain. These preparatory steps reduce complications and ensure the decision to remove is clinically appropriate and timely. Finally, plan post-removal monitoring and education. Once the catheter is out, observe urine output, color, and vital signs and ensure the patient can void within the expected time frame. This flags retention or other issues. Make sure the patient knows signs to report: fever, persistent pain, decreased urine, or bleeding, and provide clear contact instructions. If the patient experiences obstruction or severe pain, stop. Do not attempt further maneuvers yourself, and contact the clinician immediately so they can evaluate and intervene.
Thanks for watching. Consider subscribing if I helped unscramble your problems.